The big one, probably the most commonly asked question online, does TMS cause seizures? I know you touched a little bit about it earlier, but I want to really hone in on it. That's from what I see and when I'm talking to people, that is the biggest concern. Before I did TMS, that was my concern. Does TMS cause seizures? Am I going to be okay going through this process?
So again, the likelihood of TMS causing a seizure is less likely than having a seizure with an antidepressant medicine.
Mm-hmm.
Antidepressant medicines, if you take a look at the package inserts for Prozac and Cymbalta and all of them, will have a record of seizures, usually 1 in 1,000 or 3 in 1,000, right? So put those numbers in your mind, 1 in 1,000, 3 in 1,000. TMS is 1 in 60,000 treatments. So if we take a look at that, it's 60 times less likely to have a seizure with TMS than taking your antidepressant medication. And if you take your antidepressant medication, it can happen anywhere. It can happen in the car. It can happen when you're driving, walking, anywhere. So in that sense, TMS has a really good safety profile. Now, I'm going to make a distinction between, there's two major different types of systems of TMS. There is the figure of 8 coil, which is about 1 in 60,000, and that's about 7 out of the 8 systems. And then you have the Brainsway Hesed coils.
Yes.
They're about 1 in 7,000 treatments.
Okay.
Whereas the figure 8 coils, 1 in 60,000 treatments. Now, so some of the theories about the Brainsway H coils are that they're a bit deeper.
Deep
TMS,
TMS.
the way they work, so they may have a little bit higher rate of seizure, but still it's 1 in 7,000, not 1 in 1,000.
Yeah.
So they're at 7-fold more likely to have a seizure with an antidepressant medicine than with a Brainsway H1 coil.
Are there any common factors around TMS causing that seizure? Is it preventable with, proper medical treatment, a proper assessment being done prior to doing TMS? Is there something that a doctor should be looking for? Something
Absolutely.
along those lines?
So there's when we do our assessments, we specifically ask about history of seizures, history of head trauma, history about metal in and around the head, all the concussions, all of that kind of thing. Certainly brain injuries make you more likely to have a seizure. Prior history of seizure is also more likely to have a seizure. Now, I want to make a statement that I think it's 50% of people sometime in their life will have a seizure, but that doesn't mean you have epilepsy. Epilepsy is persistent seizures that happen either of cause or no known cause. It's not uncommon from a medication effect or withdrawal from a drug effect or an alcohol effect to get alcohol withdrawal seizures, drug withdrawal seizures, those kind of things. But that doesn't mean you have epilepsy. So that we make a distinction about seizures versus epilepsy.
Thank you for that.
Now, so we first want to ask about history of seizures, history of epilepsy, history of head trauma, or history of recent head trauma or stroke. Those are all more likely to have seizures, and those are things that we're going to want to know about before. And then I go into best practices. We got some best practices when you're doing TMS. And number 1, you need to sleep.
Yes.
If you're up all night and then you get TMS, you lower your seizure threshold, might be more likely to have a seizure. So get at least 4 hours of sleep, ideally 7 to 8 hours of sleep. So that's one best practice. The second is alcohol. And if you, it's been shown that people who are heavy drinkers, and this is where a few of my colleagues have had patients like this, where patients have had a seizure with TMS. It's like, they're drinking a 12-pack, every night, a 12-pack, and then their wife says to them, like, you got to get help. You're depressed. So they come to the TMS center, and they say, I'm going to do a good job. I'm going to stop drinking.
Yep.
And they stop drinking, and they get their TMS. And when you stop drinking after drinking a heavy amount over a long period of time, you lower your seizure threshold, and you're more likely to have a seizure. So we don't want somebody immediately to stop drinking. So we really want you to limit your alcohol use during TMS. I don't want people drinking ideally during TMS because a couple of reasons. One, you lower your seizure threshold if you're drinking a lot and then getting the TMS. And the other is it disrupts your sleep at night when you're drinking.
Mm-hmm.
And you and I have talked about this. And when you're disrupting your sleep, you don't manufacture your neurotransmitters. You don't clean out the metabolic byproducts of your day. You don't have the healthy aspect of dreaming is really important. You don't have the healthy aspect of really implanting your memories, because that also happens during sleep. So all of those are really important for treating your depression. So if you're not sleeping because you're drinking, you're also not helping yourself with TMS in that situation either. So we really want our patients sleeping. We want them to be not drinking. We want people to be taking their antidepressant medications. They don't go on and off and on and off their medicines.
Right.
We want them to be specific. And we want them to come to their TMS sessions on a regular basis so they get the benefit. They recruit the beneficial effects over time. So those are all the ways that you can prevent the seizures from happening with TMS and also get a better outcome.
If you guys found the information in this video helpful, do yourself a favor. Click on this video right here.
Seriously, click on this video. Click on this video.